In Parkbury House, a GP surgery in the town of St Albans, patients gather together each week to receive group acupuncture. 2 papers in Acupuncture in Medicine look at the clinic and measure patient satisfaction and the cost implications of the service.
We run the clinic here in this practice every Thursday afternoon for 2 hours. We start off seeing them quite regularly, so we see them once a week for 4 weeks, and then we start to extend the times at which we see them. So they're not all here every week by any means. Most of them are coming every 6 weeks or something like that, whereas the new ones we're seeing much more frequently.
And I bruised.
Yes.
That is going now.
So the important thing is these are patients who are at the end of the road as far as their arthritis is concerned. They've had physiotherapy, they've had drugs, they may have had arthroscopic surgery, and really the only option for these patients is a knee replacement. By definition, for us to be able to treat them, they have to have severe pain, they have to have restricted mobility to under 50 yards, and their condition can't be managed by any other means.
I think that would be more sensible.
The data that we've analysed showed in the first year we had 114 referrals to the clinic. So these were all patients who were deemed bad enough to need a total knee replacement. Of those, 90 patients took up the offer of having acupuncture, and after a month we'd retained 84 of those patients in the clinic. Now if you look ahead to the 2-year mark, we had 31 patients still having acupuncture, and these patients would be having treatment no more than every 6 weeks, sometimes less, to keep their condition under control.
Lovely. So how have they been?
It's not a lot.
Some of them are a bit surprised about the group situation because they've never been treated in a group before. So we explain that that's how we do it at this clinic, and we don't give them an option. And actually once they get in here, they very soon get used to it, and as you can hear, they start chatting very quickly to the other patients.
Do you have the machine? Yeah, I do normally, but I don't mind if I thought perhaps today we were.
Group acupuncture has proved really acceptable to our patients, and in fact has far exceeded my expectations. Anthea Asprey from the Peninsula Medical School has carried out some really interesting qualitative research into this and collected some wonderful quotes from our patients. By coming together and having acupuncture, it provides a supportive framework. It allows our nurses to disseminate education and also gives the patients an opportunity to make new friends.
And they've been doing some research work, and it's about to be published.
About cost particularly.
One was about cost and one was about patient acceptability.
The potential for cost saving was one of the main drivers for setting up the clinic and the reason why we got permission and funding to run with the clinic in the first place. So we're very excited that our 2-year analysis has actually shown that we may well have saved up to £100,000 in the first 2 years of the clinic, and hopefully more beyond that. Although this is a difficult area to be accurate in making estimates, when a patient comes to the clinic it costs £20 per treatment. Knee replacement come in at a tariff cost of between £5,000 and £6,000. We also know that it saves money in the local health economy. Even if you defer surgery by a year, there's a small percentage saving to be made. We feel that we've got the potential of saving a lot of resources, and therefore that money going back into the local health economy.
I tell you, you can join us, you know.